My name is Jorge, and my teammates are Sangeeta and Asma. We're working on biosensor for microbial detection under the mentorship of Dr. Wen and her PhD student Luis Soto Garcia. On average, hospitals take 24 hours to detect a microbial infection. In cases of these infections, time is crucial as things can only get worse. For quick detection purposes, we have designed an affordable, easy-to-use biosensor that can detect 2 different types of bacteria under 10 minutes with a small sample. Our biosensor is paper-based and uses a combination of 2 techniques, lateral flow and ELISA direct sandwich format. The biosensor will be able to detect E. coli, a gram-negative bacteria, and S. aureus, a gram-positive bacteria. The lateral flow technique used for the detection of E. coli and S. aureus indicates the presence of bacteria by illuminance of gold nanoparticles on respective test lines. With ELISA sandwich format technique, the interaction between the antigen from the sample and deployed antibodies is amplified to give clear output.
Because of above-mentioned reasons, there is a need for an easy-to-use, quick, and cost-effective technique to detect the presence of these common pathogens. The result through our biosensor can be obtained in 5 minutes through a quick flow of sample across the paper strip that alleviates long wait time in conventional E. coli or Staph aureus lab culture and testing. Quick detection leads to an early start of appropriate treatment, which can help patients as well as healthcare professionals. The figure 1 on the bottom left shows our assembled prototype.
The specifications for the biosensor are a readout of 5 to 10 minutes. Minimal level detection is 1,000 colony-forming units per milliliter, a device response with illumination of gold nanoparticles, and the constraints are able to withstand 100% humidity, able to work in room temperature, a shelf life of 1 year, a cost of $1 to $10 per unit, and able to withstand sterilization. A quick summary of how our biosensor works: a sample of bacteria with saline solution will be introduced onto the sample pad and flow towards the conjugated pad and bind with capture antibodies conjugated with gold nanoparticles. This new complex will flow towards the membrane pad and interact with the antibodies immobilized on the test lines. Herein the bacteria is present, the original sample, the gold nanoparticles will show greenish color as an indicator. Control antibodies are also deployed at the end to validate the test. An additional liquid will be absorbed in the absorbent pad.
Our test plan was divided into 3 phases. In the first phase, we did flow rate test with variation in position and volume. So we introduced, at first we pre-treated all of our papers. Then we assembled it on backing card. We introduced the sample, waited for the sample to flow, and then finally read the results. Our second phase was testing with E. coli, where we performed tests with a sample with different concentration of E. coli as well as blank sample. Our next test will be testing with E. coli and Staph aureus, where we will have test lines for Staph aureus, E. coli, as well as control. Figure 2 and Figure 3 show the specification of our testing in Phase 2 and Phase 3.
Different ratios of gold nanoparticle and PBS was used to test the optimization of the gold nanoparticle, and we were able to achieve the best results at the dilution ratio of 1:1. Likewise, prototype 1 was used to test flow rate of the sample. With different variations of the pretreatment, the kind of a paper we were able to have the best results, which is a readout time of 3 minutes for the red dye. Likewise, prototype 2 was used to test the bacterial sample, which in our case is E. coli. The fluorescence clearly indicates the presence of E. coli, and the illuminance is the result of interaction of bacteria and the gold nanoparticle plus antibody. Our approach of detecting the presence of gram-negative and gram-positive bacteria with the help of paper strip at one time is an innovative approach. As E. coli test has been successful in detecting the bacteria, the same procedure can be used for Staph aureus. Since the results were only visible under UV light, in order to amplify the signal, our team is planning to increase the concentration of gold nanoparticle. Some of the constraints like shelf-life, humidity, cost of the strip can be achieved in the future, provided the longer time frame for the project. We'd like to thank Dr. Wen and Luis Soto Garcia for their constant mentorship, and Dr. Bevani for suggestions regarding any improvisations. Thank you.